Anatomy can be studied in three main ways: systemic, regional, and clinical. The systemic approach focuses on body systems like the digestive or respiratory system. The regional approach studies specific areas of the body and how structures relate to each other. The clinical approach applies anatomy to real medical situations. Each method helps students understand the human body in a different but important way. Skeletal system. The skeletal system is divided into two main parts. Axial skeleton includes the skull, vertebral column, ribs, and sternum. Appendicular skeleton includes the bones of the upper and lower limbs. Bones. Bones are a type of calcified, connective tissue made up of living cells called osteocytes, which are embedded in a matrix of minerals and collagen fibers. Each bone has an outer layer of compact bone and an inner layer of spongy bone. Inside the bones is soft tissue, known as bone marrow, where blood cells are produced. Bones have several important functions. They store minerals such as calcium and phosphorus. They act as levers for muscles, allowing body movement. They protect internal organs and support body structure. Bones can be classified into ways: by shape, long bones, short bones, flat bones, irregular bones, and sesamoid bones. By development, endochondral bones and membranous bones. Long bones. Examples of long bones include the humerus, radius, ulna, femur, tibia, fibula, metacarpals, and phalanges. Long bones develop through a process called endochondral ossification, where bone replaces a hyaline cartilage model. A long bone has a shaft called the diaphysis, two ends called epiphyses, a region between them called the metaphysis. Diaphysis. The diaphysis is the main shaft of the bone. It is made of a thick layer of compact bone that surrounds a hollow marrow cavity. Metaphysis. The metaphysis is the region between the shaft diaphysis and the ends epiphyses of a long bone. During growth, this area contains the growth plate and plays an important role in bone lengthening. Epiphyses. The epiphyses are the enlarged ends of a long bone that form joints with other bones. During development, they are separated from the shaft by the growth plate. These ends are mainly made of spongy bone, covered by a thin outer layer of compact bone. Types of bones. Short bones. Short bones are small and roughly cube-shaped. Examples include the bones of the wrist carpals and ankle tarsals. They are mostly made of spongy bone, surrounded by a thin layer of compact bone. Flat bones. Flat bones include structures like the ribs, sternum, scapula, and parts of the skull. They consist of two layers of compact bone with spongy bone in between. These bones provide protection and broad surfaces for muscle attachment. Irregular bones. Irregular bones have complex shapes that do not fit into other categories. Examples include vertebrae, skull bones, and hip bones. They are mainly composed of spongy bone covered by a thin, compact layer. Sesamoid bones. Sesamoid bones develop within tendons. Their main function is to reduce friction and protect the tendon from damage. A common example is the patella, which improves movement and reduces stress on the knee joint. Clinical correlates of bone. Bone cells and hormones. Bone is constantly being renewed through two important cell types. Osteoblasts are responsible for building new bone. Osteoclasts break down old bone tissue, releasing calcium and minerals into the body. This continuous process is called bone remodeling. Hormones also play a key role. Parathyroid hormone increases calcium levels in the blood by stimulating bone breakdown. Calcitonin does the opposite. It lowers blood calcium by reducing bone resorption. Before bone becomes hard, it first exists as a soft organic material called osteoid, which later becomes mineralized. Bone disorders. Osteomalacia. Osteomalacia is a condition where bones become soft due to poor mineralization. It is commonly caused by vitamin D deficiency or kidney problems. Osteopenia. Osteopenia refers to reduced bone density. It occurs when bone formation is not sufficient, leading to weaker bones compared to normal. Osteoporosis. Osteoporosis is a common age-related disease where bone mass decreases significantly, making bones fragile and easy to fracture. It happens when bone breakdown becomes faster than bone formation. Common signs include compression fractures of the spine, Loss of height. Development of kyphosis. Increased risk of hip fractures. Osteopetrosis. Osteopetrosis is a rare condition where bones become overly dense due to defective bone resorption. This leads to the loss of normal marrow space inside bones.